It was only a few months ago when the American Cancer Society changed its breast cancer screening guidelines for women. The recommendation for women of average risk advises beginning annual mammogram screenings at age 45. Though women ages 40 to 44 should have the choice to start annual screening if they wish to. The ACS also recommends that women forego manual breast exams, since research does not show they produce a clear benefit. For women 55 and older, the guidelines now recommend mammograms every 2 years, or to continue annually if desired. Every year, about 200,000 women in the U.S. are diagnosed with breast cancer, but according to the American Cancer Society, death rates from the disease have been steadily declining since 1989. The specialists at Florida Hospital Waterman's Digital Mammography Center want you to know that screening is a crucial part of surviving breast cancer.
The purpose of the mammogram is to get good imaging to detect breast lesions and breast cancer. 85% to 90% of breast cancer can be picked up by mammogram. MRI is good, but it's a useful tool in helping us characterize breast cancer. It is not good in evaluating calcifications and other areas, so that's the most important thing. I get a lot of questions on that. The routine mammogram still is the gold standard for women getting yearly screening examinations is the most important thing. If we find something wrong on a screening mammogram, we contact the patient with a letter, as well as we contact the patient's physician who sent the patient for a mammogram. And within 1 to 2 weeks, they come back for what is called as a diagnostic mammogram. And the diagnostic mammogram can also include an ultrasound, because what we do is, depending on what we find at the time of mammography, whether it's a mass or microcalcifications, we do further specialized views, which include like spot compression and spot magnification views, and we do an extra 90-degree view of that breast. And if it's a mass, we further do an ultrasound, because ultrasound helps us to determine if the mass is solid or cystic. Cystic 99.9% being benign. If it's solid, then we'll have to pursue next to a biopsy. Routine screening yearly mammograms are covered by all insurance companies. So there is unfortunately no excuse not to get your mammogram.
If you'd like more information about their digital mammography services or to schedule an appointment, follow the Surviving Breast Cancer Story link on our homepage at yourhometownhealth.com.